The CDC makes recommendations, but they don't make our local rules. So these new guidelines released today help us come up with what we should do in places, but they don't tell us exactly what we should do in our local region. So just a reminder to folks that we should follow our local county guidance, which is often informed by state rules. I think even at a more granular level, just remembering that the businesses that we frequent and where we're going actually have complete control over their location. And if they, in a region where we're not told to mask by the state or the county, if they want us masked, they can also ask us to mask, and that's okay. We have to change, things are moving and case counts are dropping. So at some point we do need to ease mask restrictions and get back to a place where we don't necessarily have to mask everywhere always. But I am worried about what things are going to look like when the majority of people stop masking in indoor spaces. And I think we just have to be ready to pivot. We're going to follow the data really closely, as we always have. Look at the numbers in our hospitals, which is a new emphasis of the CDC guidance, which I think is great. That's a number that I always look at. We're going to look at transmission in our schools, in our county, and if things start going up or we have a new variant, I think we're just going to have to be ready to pivot, as we have all along. And I don't think this is going to be any different. If you are going to a place where there is no mask mandate in indoor public spaces in place, you still get to wear a mask if you want to. And you get to wear a very good mask if you want to. And this has been emphasized by the CDC. So I want to make sure that folks still feel comfortable doing that. If it's something they would like to continue to do as we travel in the future, I think masks might be with us to stay when we're in those large, crowded spaces where we're close to folks we don't know for long periods of time. I think going forward, places where masking really is a minimal burden, especially during transmission of respiratory virus seasons, or if we see another surge or beginning of a surge, like a grocery store, I don't mind wearing a good quality mask in a grocery store at all. It causes me no change in my life. And so to protect other people around me and to protect myself, I think that's something I'll continue to do for a while. In Washington State, even when the mask mandate for other indoor public spaces goes away, there are some call outs, and hospitals and physicians' offices and dental offices and pharmacies remain a call out. So we're going to keep masking to protect the vulnerable patients that we care for in these places and keep our healthcare workers safe as well.